just wanted to say a very warm welcome to everybody. This is always a highlight and a really exciting moment for me personally to be able to connect directly with you all, and I know that it's inspiring for the rest of my colleagues at the Shot at Life campaign too. This is an incredible sacrifice and commitment for you guys to be showing up here on a work day, or whether you're in class or retired or working or wherever you're really coming from. You're donating and committing time out of your day for an incredibly good cause, and we're just so appreciative of your time. So I just wanted to say a little words about myself really quickly, a self-introduction here. I know that some of you are new and I haven't been able to meet you in person yet. My name is Brian Massa. I'm the Director of Government Relations for the Shot at Life campaign. I've been with the campaign for a little over 7 years now, which is crazy to think about. I know that I've known some of you on this chat right now for that entire time, and some of you were actually predating me on the campaign. But I'm also really looking forward to meeting everybody, all the new champions as well, and hopefully we can see you in person in our in-person summit next spring. So prior to the campaign, I worked in the Senate. I was with the Health Policy Office of the Senate Health, Education, Labor, and Pensions Committee under Tom Harkin, and so I sort of worked on child vaccines from the global side through the CDC and the Center for Disease Control portfolio. So I've been working on these issues for a long time on kind of both sides of the advocacy table as a congressional staffer and now as a Shot at Lifer. And so I really have been inspired and really happy to help you guys amplify your voice, because that's what this is all about. So first of all, I want to say that I did come up with the title of my own session there, Making Sense of the Dollars. So I hope everyone enjoys a little dad joke at the beginning of their morning. I'm entitled to do that, but as a father of two young girls. So, all right, let's jump right in. So today I want to go over a couple of key points, and I've listed those out here. Given that we're all coming from a wide background of advocacy, some are seasoned Shot at Life champions, some are maybe just starting out their advocacy completely fresh. I do want to go through a refresher on the annual budget process in Congress. So we'll start with that, because I think that that's one of the most important things as savvy advocates to really understand the big picture. We all are experts in our issue area around child immunization and growing in our knowledge base for that, but we really need to know about the federal budget process to be an effective advocate. So we'll start with a refresher on that. We'll learn about those key congressional advocacy moments throughout the year, because part of my job is to marry up those key congressional budget process moments to your advocacy actions. And Rebecca and the grassroots team work really hard and work really closely with me to make sure that we're coinciding those moments to maximize your impact. Now, this is getting a little bit weedsy, but because you guys are here, because you guys have shown such commitment to advocacy, being here today for this conference, I want to talk about something that's really important right now for Congress over the next 3 months. And this is something that is referred to as a conference committee, and I'm going to unpack this for you when we jump into these slides. But this is a little bit inside baseball that I wanted you guys to learn a little bit about, because over the next 6 weeks of this advocacy period, the Mobilize to Immunize advocacy period, this is a key moment in Congress. And the reason it's key is because of this conference committee that's going to be happening over the next couple of weeks. And so I also want to kind of talk about the key appropriations requests, because that is, of course, why the campaign exists, is to ask the federal government for more money for child immunization. And some of you are well aware of all of the different budget categories for child immunization that Shot at Life advocates for. This might be new for some of you. So I want to actually unpack those and then drill down into a couple of specific lines that are directly related to this conference committee situation. And then, if you guys are still with me, who doesn't like a little trip slideshow? I had the opportunity to travel to Nigeria in August this year, so I have some photos from that trip, and I think it's a nice way to end the kind of nitty gritty of the budget process and the budget lines with a step back and a good reminder about why we do this. Okay, so let's start from the beginning here. Beginning of the annual appropriations year. So there are some critical moments throughout the congressional budget process that are vital for us to time our advocacy to. When I was a staffer for Senator Harkin in the Help Committee, one of the most gratifying moments of my day was when we had constituents and advocates come talk to us about a ton of different issues. Because as a staffer, the bandwidth is incredibly small. You typically, a portfolio for a staffer is not just one issue, not just say global health, but a range of, sometimes a half a dozen different issues. One staffer might cover health, education, environment. And so you don't have the opportunity always to drill down into very specific, important elements of that. So I really depended on advocates like you guys to educate me. So the other side of the coin, though, is there was never something more frustrating to me than to have those savvy advocates come to the office, travel all the way from across the country to talk to us about these things, but they were coming at the wrong time of the year. So this is why I really talk about the timing of all of this, because it's not just enough to be a trained, savvy, passionate advocate. You have to know when the right time is to be on the Hill. And so this is why I go through this process. So if you look at the top section of this slide, I've basically listed out the most important time periods for the congressional appropriations cycle on the top, and a link to them to the times of the year, of course. And then on the bottom, I've tied those to specific advocacy actions that Rebecca and the grassroots team ask you all to do periodically throughout the year. So let's just quickly start at the very top left. In the dark blue, we have the president's budget request. This really just kicks off the year of appropriations. The president's budget request is essentially a menu of things the president would like to see Congress focus on and fund throughout the year. I think it's typically something that sort of is put a lot of thought and effort into on the administration side, and then no matter who's in charge, Democrat, Republican, doesn't matter. They send it to Congress, and typically it falls with a little bit of a thud, because in Congress, of course, appropriators, they are constitutionally authorized to fund the government, and so they don't feel like they need to think and listen to the president. So in any case, though, this starts the thing off. So this sets the tone, and we do advocate a little bit to on the direct side that I do to ensure that the president's budget kind of has those high numbers for child immunization programs. However, it comes to Congress. Congress says that's great, we're going to do our own thing, and that kicks off the year. So next up is the budget resolution. So Congress, to start their own sort of process, has to figure out how much money each of the appropriations subcommittees has to deal with, and actually each of the committees. So what they have to do is they pass a resolution setting what we call the top line level for these subcommittees. So there's a budget resolution process. And basically what we're trying to do is ask for the highest amount of money that would go to foreign affairs and global health. Because what we know is that if you have the highest top line number, you can have a bigger slice of the pie. So theoretically, at least, you have more of an opportunity to advocate for more money for child immunization. So during this time period, it's a really critical time for Shot at Life to be weighing in with members of Congress, because of course those are the ones making the decisions there. And as long as you can increase that size of the pie, you have a really good chance for the rest of the year, as the rest of the kind of process unfolds, to get as much money as possible for child immunization. So moving on, after those kind of top line numbers have been set with this budget resolution, that's when the subcommittees on appropriation really get down to brass tacks and start working on their bills. And Shot at Life advocates for budget lines that run through two subcommittees. One manages kind of the public health side of funding for the government, and it includes the Centers for Disease Control and Health and Human Services. And then also it funds the foreign affairs side through what they call this Senate State and Foreign Operations Committee, called SFOPs. So those are the two places that we really focus our advocacy on. And they are the ones that are now in this gray period, this May, June, July period, starting to prioritize where the money goes to. So during this time, it's a really important time to weigh in with Congress. And so we time our advocacy actions throughout the year to do that. And primarily, we have the Spring Summit, as you see in that blue box, it leads into the time period called Advocate to Vaccinate, which is another 6-ish week period where we, do a range of advocacy actions like calling your congressional member, writing them letters, doing op-eds, increasing the visibility in your home district and state, and those are really important time periods. So moving on then to this kind of green box, August and September, and this is where it gets a little theoretical, because Congress is by law required to hit certain benchmarks of passing bills at certain times, and they never do that, and they haven't done that for a very long time. So in August and September, the fiscal year, it ends. The federal government's budget ends at the end of September. So this is where you start hearing conversations about federal government shutdown when Congress hasn't passed their spending bills because of lots of different wrangling and politicking that's going on. So I say theoretically Congress finalizes their spending bills by September, because otherwise the government's going to shut down. But what really happens, and we see this in the news a lot, is that they pass something called a continuing resolution. So that's what CR means there. And basically what that means is that Congress says, look, we don't have enough time to actually pass a new spending bill for this year. We're going to buy ourselves some time, whether it's a couple weeks, often it's a couple months. We're going to buy ourselves some time. And so we're just going to lock the same amount of spending in from the previous year. We're just going to continue that for 3 months, basically. So if they ever did pass a bill on time, which I'm not holding my breath on that for the immediate future, that's when it would be a really great time to thank the members, because one thing, it's one thing to advocate for money, but they also really like to be thanked, as we all do. And I think that's something that's not a lot of campaigns actually do, is actually follow up with the members to say thank you. So I think that's actually a really nice relationship building moment to do that. However, we haven't really thanked members in August or September for a long time with the campaign, because they haven't actually passed the bills on time for a long time. So moving on to orange, this is really what actually happens in Congress and in the appropriations process, which is Congress during this October-November period where they have passed a continuing resolution. Now they're really getting down to hashing out the final appropriations bill, because they bought themselves a little more time. So during this time, what's called a conference committee is established. That's when you have a couple of members from both sides, the House and the Senate, coming together to talk about basically hashing out the final bill. And so this is happening now, and I'm going to go through this process a little bit in more detail next, but this process is about to begin now. So it's a really great time for you guys as advocates to be weighing in with your members, because this is a place where we can really start actually increasing some dollar amounts for our programs. So we've got Mobilize, Immunize there in the bottom right orange box, and this is the time period that we're weighing in on. So let's talk a little bit more about this conference committee process. So when the House and the Senate they pass different versions of a bill, Congress has to basically find a way to reconcile the differences between these two bills, because of course the Constitution says you have to pass two identical bills for them to actually reach the president for his or her signature. So the conference committee is one of those ways that they hash out these differences. So the House has already passed some of their appropriations bills, and the Senate has already passed or has passed out of committee sort of their appropriations bills. So there's a lot of differences between those two bills. How are they going to reconcile them? Well, the bill is sent to a conference committee, and a select number of members from the House and the Senate are selected basically to come together in a small group, sitting in a conference room and literally just talking about the bill and trying to reconcile them and match them up. So the conference committee over a number of weeks will iron out the differences between those two bills. And with appropriations bills, almost always they're sort of they reach an agreement on them, because it's critical to fund the government. So it's not something they can really just kind of throw their hands up at and walk away if they can't come to an agreement on something. They really do need to. So if the committee reaches an agreement, and they will for an appropriations bill, then they send this new report back to both chambers. The House and the Senate need to accept the compromise and vote on it. and then they're voting on the same exact bill. So this is how the Congress basically hammers out these details. And I included a little photo here of an actual conference committee. This is actual senators sitting around the table, and that's literally what it looks like. I mean, it sounds very kind of esoteric, I think, and kind of hard to understand. It's literally just people sitting around and talking about two different bills and trying to hammer them out. So currently, I mean, why does this matter for us? What does it matter for our advocacy? So currently, the two bills that are on the table, the two spending bills that are on the table, are the fiscal year 2023 bill. That's just the bill that we've been talking about and advocating for throughout this whole year. There's one passed by House appropriators for this year, and there's one passed by the Senate. So let's take a closer look at these two packages, because they actually have different funding numbers for our programs. The House passed theirs with a certain level, and the Senate passed theirs with a different level. So let's take a look at the actual numbers. And I warned you the next two slides are a little bit text heavy, and I'm sure that I'm going to raise the blood pressure of my comms colleagues, but the numbers are important. So that's why I include them. It's what we're all sort of here for. And for me, anyway, it's easier to see the numbers than to hear somebody just talk about them. So I wanted to put this slide up. And this shows, it's a little text heavy, but it shows the different budget categories that the Shot at Life campaign advocates for every year. You do not need to memorize this. You don't need to write it down. If you want to, you can reference it. It's in the leave behind materials for the congressional staffers that we will give you or send to you if you haven't already seen those. It's what you'll leave with the staffers when you do your meetings this activation period. The staffers love these charts because they see the full context of not just what we're asking for this current year, but the previous years too, and kind of where the budget categories came out to. So on the far left, we see all the programs we advocate for. I've included the agency too, where they sort of go through. So you see at that, you see polio activities that go through the USAID. Gavi, the Vaccine Alliance, also runs through USAID, UNICEF, and then the bottom two rows include polio eradication and measles elimination that go through the CDC Global Immunization Division. That's what GID is. So on the top row, then we see the progression of the funding for those programs over the years. Fiscal year 21 is the beginning year that I chose. I didn't need to go too far back. Then there's the final appropriations package for the next year, FY22, fiscal year 22. And then the remaining sort of four columns are what we were talking about, all about this year. It's the fiscal year 23. That's the current budget that we're trying to advocate for. It shows the president's budget request that I mentioned earlier in this session at the beginning that he releases in February. And then it shows the final three categories are what we'll really focus on here. So let's go to the next slide and take a look. I've simplified this because we don't need to pay attention to those other ones for the purposes of the conference committee. So I've highlighted the last three columns there for a reason, and it's for polio specifically. So out of all of those advocacy categories that Shot at Life supports, we're just looking specifically at the two polio budget lines, the one that runs through the USAID agency and the one that runs through the Centers for Disease Control. Now, if you look at the yellow column, you'll see that the House appropriators released a bill that included $75 million for polio activities at USAID. And you can see that this is level funding, the same amount of funding basically as the previous fiscal year. So if you look at the FY22 column, you see 75. That was the same amount. They also released within this bill, or approved the bill, that included $180 million for polio activities through the Centers for Disease Control. So the House has released this bill, and it's different if you look at the green category than what the Senate released. The Senate approved $85 million for polio through USAID and $183 million. So you can see that it's higher for both of those activities on the Senate bill. So, and then I'll just say quickly, Shot at Life's request is in the orange category, and it's clearly much higher than both of those for both agencies. We included aspirational levels for polio because we know that over the past 3 years, the polio program has been double taxed basically in responding to COVID-19 while also trying to eradicate polio. So we know that there's a huge amount of unmet need within the polio program. And so we were asking for these very high numbers, which are totally justifiable. And we worked really closely with the agency to come up with, implementation, justifications, and absorption rates and things like that. However, let's go back to that green category, because that's important for the conference committee. You've got these two bills, House and Senate bill, just sitting there. And what we need to do now is focus on ensuring that Congress in this conference committee accepts the Senate higher numbers. And so what I've done is include an extra sort of talking point that links all of this together for your meetings, for your phone calls, for your letters that you'll be doing over the next few weeks. And basically what we need to be telling Congress, both the House and the Senate offices, is that this talking point that I've inserted in your talking point sheet, so you don't need to write this down either. But Congress recently passed a continuing resolution to fund the government until December 16th. That's that CR that I mentioned that's keeping the government operating at the previous year's funding levels, just buying them some time. So during this time, at minimum, we're asking all of our members to support the polio funding levels contained in the Senate's bill. And that's that same, I'll go back again, because you see 183 million for polio at CDC, you see 85 million for polio at USAID. That's what those numbers line up to in the green column there. So that's a really important and also a really savvy message to bring to Congress, because you're not just going there talking about general fiscal year 23 numbers. You're talking about a specific bill that the Senate appropriators, the Democratic Senate appropriators have released, and has basically put money on the table for the polio program. There's about $15 million increase actually that's on the table and available to advocate for right now. So I've put that talking point, that extra talking point in your messaging materials. And I think it's going to elevate your advocacy. I wanted to dive into something that's a little bit weedier than what I would normally do, but you guys have all showed up today. Taking time out, I can. It's obvious your dedication, and so I wanted to talk a little bit about that. So that's kind of concludes the presentation that I have. I want to make sure that we have some time for questions. So I will just quickly zip through the fun part. I mean, it's all fun, right? But the more fun part of my presentation, which is a quick slideshow of the Nigeria field visit that I was able to take a part of in August. So it was an amazing experience. I mean, we traveled all around Abuja, the capital, for about 6 days. Saw some incredible rural and urban health delivery, some immunization delivery. We visited a lot of clinics with WHO and UNICEF, seeing how kind of health workers on the ground are delivering these immunizations. We saw some of the kind of technical side of things too, where we were able to visit some laboratories that were, testing samples of vaccine preventable diseases, and a really important component of global health security too, because it's always more affordable, less costly, and saves lives to identify and contain outbreaks of diseases at their source before they blow up and spread throughout the world. I mean, there's no other example better than this than of course COVID-19. So we were able to tour some of their incredible world-class laboratory facilities that were supported by CDC and by USAID. We were also able to visit with polio survivors, and one of the activities that we engaged with them on was a para soccer activity, which was an experience that I will never forget for the rest of my life. Basically, Rotary has supported teams of polio survivors to form para soccer teams in a league across the country, actually, and pair this with not just the sport and the pride that goes into it, but pair it with vocational training and educational scholarships. But the pride that you could see from these players was incredible. As advocates for their disability, changing the perception too in the country of what a disability is, and they use their hands basically to hit the ball and play soccer. So it was an amazing experience. We had an opportunity to talk with them too, and you could just tell the pride that they had with representing their team and their sport, and also representing disability rights in the country. They actually just passed something that was similar to the Americans with Disability Act a few years ago in Nigeria, and a lot of them had supported that. So we were able to meet with them. It was an incredible experience. Dennis Ogbe, who also is one of our amazing champions, of course, many of us have been inspired by his story. I was emailing him in real time, basically, with this group because Dennis grew up in Nigeria, and so I was able to tell the story of Dennis's, growing up in the country and how he came to America, and of course that was incredibly inspiring to the survivors here of the para soccer team. So thanks, Dennis, for responding so quickly to my emails as I was literally on the way to this activity. So also really important in this country is community engagement, of course, and one of the primary kind of community advocates at the last mile level is the Emir, basically the Emir of different areas of the country. They are sort of pseudo royalty and trusted advocates in their communities. And so the Emir of Jiwa, a place outside of Abuja, hosted us, and kind of it was a great honor to be there with him. He talked about how they established trust in the community, and talk to community members about the things that are important to them, and connect with them in that way. So there was a very opulent ceremony with trumpets and fancy dress, and actually I was honored to be dressed in traditional Nigerian clothing, and was given the great honor of being at his right side. So this is a photo that I sent the team. I'm going to share with you too, of me sitting there. I also took a selfie on the throne and sent it to my family, and my mom texted me back, and she said, "Don't text while you're on the throne." So, but of course, it all comes back to the people, to the mothers, to the fathers, to the children. And so I had the opportunity to immunize a child there. Her name is Fadula, there in the middle. Her mom was gracious enough to allow me to do that. And it's just an incredible experience that is just a wonderful reminder to me about the work that I do and the work that you do. And I'm so proud of all of that. And so it's a real great opportunity to be here talking with you guys. And my last slide here before we have some time for questions is just me with my traditional Nigerian robes on, and of course I brought back some traditional dresses for my two girls, which is also a nice personal reminder about what I do, because I talk to them all about child vaccines and immunization, and this is why I do what I do. So thank you very much. I am happy to. I think I have about maybe 10 minutes left or so, but I'm happy to take any questions. I think we'll just probably you can select to come on screen. Maybe Lindsay can facilitate that, but I'm here for you guys. Please let me know what's on your mind, and if I can clarify anything too about what I talked about, this is a good time. So thank you.
Absolutely, thank you, Brian. So if you have any questions, feel free to put them in the chat, or you can also request to share audio and video, and you can come on screen and ask Brian your question directly. So we encourage it either way, whatever you're almost comfortable with. So I see Cindy just popped in, so I will bring Cindy on screen.
Hey, Brian.
Hi, how are you?
I'm good. Could you talk a little bit about who is on the conference committee? Because it's not all of our members of Congress. So yeah,
right.
Words about that.
Yeah, great question. So absolutely you're right, Cindy. It's not all your members of Congress. We don't actually know who's going to be on the Congress committee yet. Typically, it's like the leaders of the appropriations committees themselves, plus a few others. You saw from that photo, it's can be around 12, sometimes 15, sometimes it's less, sometimes it's more. Even if your member is not on the conference committee, they can still talk to members who are on the conference committee, and that's where the advocacy comes in. Is that they don't need to be the people on the committee to influence how that money ultimately shakes out when they're hammering it out. So when you talk to your member, you don't have to say are you on the conference committee or not. You can certainly ask that question, but even if they're not, you can say, I hope you will talk to the conferees and support the high level that the Senate released for polio eradication.
Thanks.
Thank you.
Thanks, Cindy. Next, we'll bring up, I see Bridget in here. All right, not seeing Bridget pop up, so now I'll try Ross.
Hi, Brian.
Hi, Ross.
If in meeting with a staffer or a representative, if the subject of COVID comes up, how should we be prepared to address that in terms of a talking point?
Sure. So there's a lot of different ways to address that. That depends on, can you be more specific about how it comes up and kind of what context you mean by how COVID comes up?
Well, if they ask about it as to what we are doing or what we're advocating for them to do.
So I think the best pivot from that is to talk about the health systems strengthening that all of these programs invest in. So it's not that these programs are just investing in actual, vaccine delivery. They're investing in the workforce. They're investing in the laboratory detection. There's a photo of that. We're touring the facilities there. The money that we're supporting goes holistically into those systems. That's the money that, frankly, that's the infrastructure that was used for COVID response during the early days. And there's lots of really great examples that I included in your talking points and the leave behinds about how specifically the polio program, the workforce, the polio labs, and the community relationships that the polio workers have established, those were pivoted in the weeks. Basically, it was incredible and almost real time to do COVID-19 educational outreach, to facilitate vaccine delivery once the vaccines were approved and supplied. So that's a success story of how investment in polio has been horizontally strengthening the health systems of those countries. So I think you absolutely should be talking about that. But that's not just to talk about health system strengthening. That's laying the groundwork for your justification about why more money for polio is required. Because guess what was not happening during those time periods? A lot of the polio immunization campaigns had to be paused temporarily. And so, we've seen that happening across a lot of different diseases where there was pauses in campaigns, measles as well. And so there was a period of backsliding, and that's the statistics that we'll be talking about next, actually, in the next session with our global health team. There's been a lot of loss in that. So I think that's how you pivot to that, is that you talk about it and then you bring it back to the polio increased funding, and that's going to justify it.
Is there a way to kind of address the issue that now we're sort of doing the reverse of pivoting completely away from COVID and returning as we need to polio, but now, as classic public health is forced to do, it's all or nothing. We address one disease at a time because we're only funded to do what's right in front of us at the moment.
Yeah, I think the problem was that there wasn't a specific budget line for COVID really in the federal budget. They were funding it through emergency supplemental bills, which are basically separate bills completely that they create on an emergency basis that are not part of the normal funding process. So, I think it's not something that we can probably sum up with a talking point, but the bottom line is that the investment in these strengthens all disease prevention. And so I think that's giving you the example of the polio program is probably one of the most tangible ways to make that case. And it's also something that we don't necessarily want you to kind of get too bogged down in on the COVID situation, because that frankly is a domestic, issue as well. So we don't want to kind of go too far towards the COVID element. Suffice to say that what we are supporting with the Shot at Life campaign did facilitate COVID response, just as an example. So.
Okay, thanks.
Thank you.
Thanks, Ross. Anyone else can feel free to request to come on camera. And while we're waiting for those, I see a great question from Mary in the chat. With pandemics, outbreaks, or backslides in progress, what motivates you to keep fighting the fight?
Well, I think the challenge is what's motivating. We have been accustomed, I think, in the advocacy community over the years to have seen incremental progress in, lowering child deaths due to preventable diseases. And so it's actually very exciting to me in a way to be presented with this challenge, because we're in a position, we're sort of in uncharted waters where the pandemic has set back programs by many years. So I think that it is motivating in an unfortunate sort of way. The challenges are what motivates me. And I think that part of this is setting our own expectations for the coming years, and setting Congress's expectations too, because this is something that preventing disease is always a difficult sell to Congress, because you're basically saying if this is successful, you won't see a disease, and it's difficult to kind of sell that. So I think that in the coming years, setting expectations, Congress to say this is a long-term fight going forward. That's what motivates me, and I think that there's lots of ways that we can talk about this. And I think the global health team is going to kind of unpack the nitty-gritty of what that backsliding looks like too, because I think it's important to actually understand what it is. I mean, there's backsliding, but there's progress in some areas, there's opportunities in other areas. If you understand sort of where the backsliding is happening, you're going to be a better messenger to Congress to say this is where the support is needed to combat that and to bring us out of this. So that's a great question. I think the motivation here is to meet the challenge, to meet this challenge head on.
Thank you, and thank you, Mary, for that question. I see a couple of comments from May and Chris. May is from Nigeria and is honored to listen and hear your view on the progress. Chris agrees that it's a gift to hear from people that know so much. And then we have a great comment from Janice as well about one member who's very outspoken about vaccine mandates, but emphasizing that our discussion really at Shout Out Life is about access and having the choice. Really, so learning how to frame your message is definitely key, which we'll talk more about later. So we still have a couple of minutes left in this session before we go to a quick break. If anyone else would like to put a question in the chat or come on screen.
And I can also just say thanks, Janice, for that comment. I think something I didn't touch on is this issue that we're talking about is bipartisan. It's not that it's something that congressional members don't support because of kind of the domestic issues of vaccine mandates, that kind of thing. They will actually, some that don't support vaccine mandates or domestic access in some ways, plenty of members like that will also support international access to child vaccines. So it's a little bit of a like a cognitive dissonance where you can hold those two seemingly contradictory thoughts in your head at the same time. But we focus on the international side, and it is by and far a not just a bipartisan, but even a nonpartisan element that we're talking about here, because it's saving kids' lives with affordable, effective, proven preventive measures and immunization. So I think that's a really good point, Janice, is that you can pivot from those potentially tricky areas that we see in the domestic side to the international side, and ultimately, as you found, Janice, come out with somebody who supports our programs. So so thanks for that comment.
Thank you. And Bren is now going to come up on the screen for a question. Bren, we're not seeing you. Maybe you could try to request again, or feel free to put your question in the chat also.
Yeah, good comment too, Bridget. It's one of the most unfortunate outcomes of COVID has been the just underscoring how diseases anywhere are problems for every country everywhere. So there's no better message, unfortunately, than COVID. But also, we're seeing polio pop up in environmental samples in places that high income countries that we have not seen for a very long time, and that's New York and that's London. And so that's not just true of sort of pandemic, highly infectious airborne diseases. It's true of any disease really that is communicable and can be brought into pockets of communities that are under immunized, and so that's not exempting the United States from this. There are pockets of communities in those areas that are extremely under immunized, specifically for polio, and so it's not just an issue in the developing world. So COVID is certainly a great example. And polio is another one. Measles, of course, there's been importations and outbreaks in our country and in other high-income countries of measles. It's an incredibly infectious disease, and so it really hammers home the point that vaccine access and equity is essential. It's true in our country. It's true in all countries of the world. So that's a great point to bring up.
Well, wonderful. Thank you, everyone, for all of your questions. If you have any more, we'll have a morning debrief in a little while where you can bring some of these up. We'll go out into the breakout sessions, and our staff can write down any specific questions you have for Brian, and we can definitely get answers your way.